Hey there! If you're feeling overwhelmed by anxiety or depression, you're not alone, and there's a medication that might help you feel like yourself again. Lexapro belongs to a class of medications called SSRIs, selective serotonin reuptake inhibitors. What that means is it works by balancing serotonin levels in your brain, which can improve your mood and reduce anxiety. People need Lexapro because it helps balance the chemicals in the brain, specifically serotonin, which can get out of whack when someone is dealing with depression or anxiety. It's designed for folks struggling with major depressive disorder or generalized anxiety disorder, helping to lift their mood and reduce anxiety symptoms so they can function better day to day. Without this kind of support, those feelings can take over and make even simple tasks feel overwhelming. Lexapro gives people a chance to regain control and improve their quality of life. Now, when starting Lexapro, doctors usually begin with the lowest dose, which is 10 milligrams once daily. This helps your body adjust and minimizes side effects. Speaking of side effects, like any medication, Lexapro can cause some. Common ones include nausea, fatigue, dry mouth, increased sweating, and sometimes dizziness. Most people find these side effects lessen over time as their body gets used to the medicine. It's important to know that Lexapro has some serious drug interactions. For example, combining it with other medications like MAO inhibitors, certain blood thinners, or other antidepressants can be dangerous. Always tell your doctor about any medications or supplements you're taking. Lexapro carries a black box warning, the strongest warning from the FDA, because it can increase the risk of suicidal thoughts and behaviors in young adults and children. That's why close monitoring by your healthcare provider is essential, especially during the first few months. Who should not take Lexapro? If you have a known allergy to escitalopram or any ingredients in Lexapro, or if you're currently taking an MAO inhibitor, this medication isn't for you. Also, if you have a history of bipolar disorder, your doctor needs to evaluate carefully before prescribing it. So why consider Lexapro? If you're someone living with depression or anxiety that's affecting your daily life, Lexapro can help restore balance and give you back your joy and peace of mind. It's intended for adults and sometimes teens, but always under the guidance of a healthcare professional. To get prescribed Lexapro, start by talking openly with your doctor or mental health provider about your symptoms. They'll evaluate your health history and decide if Lexapro is right for you. Remember, managing mental health is a journey, and Lexapro might just be the companion you need to take that next step toward feeling better. Always follow your doctor's advice, and don't hesitate to reach out if you have questions or concerns. Is a prescription medication used to treat major depressive disorder and generalized anxiety disorder. It belongs to a class of drugs called selective serotonin reuptake inhibitors, SSRIs. Common side effects may include nausea, fatigue, dry mouth, increased sweating, and dizziness. Starting dose is usually 10 milligrams once daily, but your doctor will determine what's best for you. Serious drug interactions can occur with MAO inhibitors, other SSRIs, or certain blood thinners. Always tell your doctor about all medications you're taking. Lexapro carries a black box warning for increased risk of suicidal thoughts and behaviors in children, teens, and young adults. It is not recommended for people allergic to escitalopram or those taking MAO inhibitors. Talk to your healthcare provider to see if Lexapro is right for you. Use only as prescribed. Side effects and risks should be discussed with your doctor.